Hi, I'm Caroline. I'm really excited to be here with y'all. I am nervous. Technology is not something I'm typically super comfortable with, so just bear with me. But I'm going to go ahead and jump into my presentation. So this is iRobot using telepresence robots for direct patient care. Having issues. Hang on.
I'll try.
Okay. There we go.
Oh. 1 second.
Maybe not. Technical difficulties. That's going forward. I warned you all.
Where is this?
Practice this. Time to call a patient tech. Looks like we have one right there.
Okay, now we're good.
Right. Yeah, we're good.
Success. Okay. Starting back over. All right. So again, I am a certified child life specialist. I have worked here at Children's Hospital Colorado in our bone marrow transplant unit in the Center for Cancer and Blood Disorders. I'm going to be explaining an experience that I had earlier this year in which I broke my wrist and had to have a brace on my wrist for about 6 weeks. And during that time, I was not able to be face-to-face with patients on the BMT unit at that time. So I had to get creative in how I was able to continue to provide child life services. And what I did was operate as a robot on the unit using our Omnibot, which is a telepresence robot. I'm going to back up and talk about transplant, child life, and Omnibot separately before combining to talk about that specific experience. So the learning objectives for this session are to examine the use of telepresence technology for clinical services with patients and families in the healthcare setting, to identify interventions and services able to be provided virtually, and to discover implications for future use of technology for telepresence healthcare provision. So what is bone marrow transplant? To put it really simply, bone marrow transplant is something that doctors can do to help people who have different genetic disorders, such as blood disorders or immune disorders, or people who have sicknesses such as cancer. These people's bodies do not produce cells in the way that we need them to. They produce unhelpful cells, which can be harmful to those people's bodies. So doctors can help by giving those people healthy stem cells, which is called a bone marrow transplant. These healthy stem cells then help those people's bodies to create cells the right way and the way we want them to. So there are different considerations in working with BMT patients and populations. These patients are extremely immunocompromised, which means that it's really easy for them to get sick. And if they do get sick, it can be really detrimental to their health. Because of this, we have different epidemiology policies and precautions. For example, one of our rules here at Children's for epidemiology for BMT is that all BMT patients have to remain on the BMT unit for the duration of their hospitalization. So this means they can't even leave the unit to go to other areas of the floor. They can't go down to the cafeteria or go outside. They have to remain on the unit at all times until they're discharged. And these hospitalizations can be pretty lengthy because just the process of transplant takes some time and can be quite lengthy in the time that it takes for a patient's body to build back up their immune system after transplant and to make it safe for them to discharge. During transplant, patients also have many different difficult procedures. They also have a very tenuous medical state during this time. The population of patients that we serve on our BMT unit can widely vary at any time. It can range from newborn infants to young adults. So now let's talk about child life. So some core competencies of our field are as follows. So all child life specialists should have the ability to assess the development and psychosocial needs of infants, children, adolescents, and their families, to initiate and maintain therapeutic relationships, to provide opportunities for play, to provide healing, safe, and therapeutic environments, and to offer coping strategies for stressful events, And lastly, to provide teaching such as psychological preparation for potentially stressful experiences. Specifically, this is what my role has looked like within our BMT unit and my most common interventions that I engage in with patients and their families. So I offer all patients the opportunity for preparation, education, and accompaniment or support for these different experiences, such as new diagnosis conversations and disclosures, procedures, scans, surgeries, lab draws, radiation, chemotherapy, hair loss and body image, sibling support, as well as just general coping and emotional support, pill swallowing, teaching and medication compliance, medical play, and therapeutic expression activities, normalization, recreational play, and event celebrations, school reentry, or end-of-life and legacy building activities. So this just shows some different interventions that Child Life can do. This also shows some different fun and events that we have on our BMT unit. This is something that's really important to me, especially with having our BMT patients admitted for so long. It's important for them to be able to still have fun and grow and develop just like they would outside of the hospital. So a big part of that is having access to different gaming and technology through Abe, our specialist. And one of the cool tools that we have at our disposal is the Omnibot. So typically when I am talking about the Omnibot with a patient or family, I describe it somewhere to the effect of it's an iPad on a stand with wheels that you control kind of like a remote control car, and it works kind of like FaceTime. Omnibot Labs has obviously a much more sophisticated definition than mine. They would define this as the term telepresence describes technology that enables a person to simulate being in one location when they're really in another location. This includes observing the surroundings in that virtual location and interacting with people and objects in that secondary location. So if that's still hard for you to conceptualize, here's a video of patients using the Omnibots to engage with a baseball team. This was done at another children's hospital.
We're gonna meet Josh. Hey, Josh.
What's up, Josh?
Hello.
I'm Edwin.
Hello.
What up? How are you doing?
This is Crew. What's up? This is Richie.
What's up, Richie? How you doing?
I'm good. All right, Richie. So this is what home plate at Dodger Stadium looks like.
Turn it to that way.
Okay.
There we go.
Oh no! Oh no!
This is hilarious. Yeah, we're gonna have some fun, and I'm gonna take you around. We're gonna talk for a little bit.
What are you gonna do today? Anything fun? You're running the bases right now.
So these buttons down here is gonna be forward, backwards. So when you're ready to go, you just hit a home run, knock it out of the park, start running.
What's going on, man? How you doing? You ready to come take a walk and just see some of Dodger Stadium?
Yeah.
Unless I'll just pick you both up and then just bring you with me. This is where all the action goes on. And hopefully you guys get better soon so you guys can get out here and we watch some Dodger baseball.
It reminds me of like Wally. Follow me. We're gonna touch home plate. All right.
What position do you like to play?
I play right center field and catcher.
That's a tough position.
I mean, it's
Hey,
easy for me.
yeah? Man, I get all confused with the signs. Hopefully you get better and then you come out here and then we can play some catch. How does
Okay,
that sound?
good.
All right, buddy. You take care. See you, Josh. Hey, pleasure meeting you. You keep fighting, all right?
Hey, you did a great job running those bases.
Thanks.
You got it.
All right, I hope that gave us a little bit better idea of what I'm talking about with our telepresence robots. So here at Children's Colorado, we use our Omnibots for multiple different reasons. We use them with patients for just fun and recreational play, to encourage ambulation to get kids up and moving, to foster exploration. to help facilitate virtual sibling visits if siblings aren't able to come to the hospital themselves. And for patients on isolation or our BMT patients who can't leave the unit, we can give these Omnibots to patients to use so that they can go and virtually attend different events that we're having in our hospital, such as in the Seacrest studio or our tween zone. So these are some different pictures of those events and patients attending them. So we're now going to combine everything that I've talked about so far to discuss that experience that I alluded to earlier. So on a day of just a series of unfortunate events where my clumsiness really came to an all-time high, I did break my wrist and was told that I had to wear a brace for about 6 weeks, and that during that time I was not going to be able to go onto our BMT unit or to interact with BMT patients and families face-to-face. This really hit hard because I wanted to find a way to continue to do my work with these patients and maintain the different therapeutic relationships that I had established. It made sense though, because going on to our BMT unit, all patients, staff, and families have to scrub in. And further, once you're on the BMT unit, all staff have to do additional hand hygiene and put on gloves before entering any patient room. So fair point, that would have been hard with this brace. So I worked really hard to figure out a solution that would enable me to continue those relationships with patients and continue to perform clinical tasks and responsibilities during this 6-week period. So it really came down to 2 different options that were available to me. So I could either connect with patients through a modality like Zoom or Skype or Microsoft Teams, or I could use an Omnibot. In comparing the 2, it really became clear quite quickly that the Omnibot was going to be the best option. Just so you all can get a picture of where I was working at this time. Our CCBD, our Center for Cancer and Blood Disorders, is all on our 7th floor of the hospital, and there are 3 different wings on this floor. One of the wings is our outpatient CCBD clinic. One is our regular hematology oncology unit, and the 3rd wing is our BMT unit. And so you only have to scrub in to go onto the BMT unit. So I was still able to come to the hospital every day, come to work, and go to my office because my office was located off of the BMT unit. So Omnibot really lent itself the best for me to be able to pop by my patients' rooms, check in, run into people or providers in the hallway as if I were in real life as me as a person. Whereas Zoom, I would have had to make sure that all of the patients I was interacting with had an iPad or a computer they could use that had, let's say, Zoom downloaded. I would then have to coordinate with each patient to determine a good time so that we could agree on a meeting and send that link out. And I would have to do that for every patient that I wanted to work with every day for 6 weeks. And that just was not really feasible, and also wouldn't capture all of the different interventions that I was hoping to continue to provide during this time. So I moved forward with learning personally how to operate the Omnibot. I did create a little name tag poster for the robot since I was using it for a long duration of time. Knowing that sometimes the Omnibot can have different Wi-Fi connectivity issues, I did put my contact information on here and encouraged people that if they were to find my robot and it looked like it ran out of battery or that it lost connection, to please bring it home to me, because again, I could not go onto the unit to retrieve it. The first day I had the Omnibot, I first just drove it around the floor, got familiar with it. I decided that I wasn't really going to see patients that day. I just wanted to become really comfortable and confident in using the technology. So these were some different realizations that came up during that day of trial practice. So of course we knew that the Omnibot was going to be epidemiology compliant since it's made of all plastic and metal. That meant that it could be wiped down with our bleach wipes, which is the restriction that is required for anything going on to our BMT unit. But something that I realized when I started using it firsthand is that this also meant that the Omnibot could be present for sterile procedures, which are the majority of procedures that occur with BMT patients. So that was a great realization that occurred. Also, I identified that there were different developmental considerations with using this robot. Similarly to other technology or other child life interventions, it wouldn't necessarily be appropriate for kids of all ages or developmental stages. I determined that it would be appropriate for the majority of kids about 5 or 6 years and older, especially if they were that developmental age as well. And that it was more of the toddler and preschool age that needed further assessment to determine if the robot would or would not be appropriate for work with them. Further, I found out pretty quickly that I needed to consider different environmental factors and different potential obstacles that could arise. For example, I drove my robot into our clinic waiting room. This, I immediately realized, was probably a mistake, as I was swarmed by every single kid in that waiting room, thinking that I was there for their entertainment and amusement. And I think my robot stayed in the exact same spot for about 30 to 45 minutes because I couldn't move an inch without fear of running into a child. So that informed me that if I were to start using this Omnibot to go see kids and to go serve for interventional purposes, I would need to use our staff hallways and entrances to avoid large crowds so that I wouldn't get stuck like this again. Additionally, I realized that there was a certain element of time that needed to be factored in. For example, the Omnibot does run pretty smoothly and can go a few miles per hour, which is pretty impressive, but is obviously not as quick as if you were quickly running to try to make it to a procedure in time. So I did realize that I would have to plan ahead more if I was trying to make it for certain interventions or experiences that I knew when they were going to occur within the day. Additionally, my robot does not have arms or hands. So opening doors was an issue. And so I had to plan ahead with my routes of where I was going and call ahead to our unit secretaries to say, okay, I'll be at the BMT doors in 2 minutes. Will you buzz me in? And then additionally, going into patient rooms, I had to coordinate either with family or nurses to let me in and out. Finally, whenever I in person go to the BMT unit, I always bring a bag around with me so that I can bring crafts or activities to kids, or if I'm providing education, then I can bring different resources to show the kids and have tangible items for that preparation. So I quickly realized that my robot also needed to be able to bring items over if it was going to function like I do on a normal day-to-day basis. So going back to Abe, our gaming technology specialist, very cleverly came up with this idea to 3D print a little basket for my robot that he secured to the base. It even has our Children's Hospital logos on the side. So this was the perfect solution for what I needed, and I was able to operate with this robot like I would normally in person, and was able to bring crafts when I did check-ins with kids for them to engage in, or to drop off decorations such as Happy Transplant Day signs. So this was a great solution to a problem that arose. Some helpful tools of the Omnibot that we realized as I used it more and for different interventions. Again, I apologize if I don't use the appropriate tech terms to describe these different things, so bear with me. But there are 2 cameras on the Omnibot. So there's the one that is the main view where you're looking out and engaging with people. There's a secondary camera that points down at the wheels of the robot. This was really helpful in knowing that I wasn't going to run into anything or run over anything. This gave me peace of mind because our BMT patients have lots of lines and monitors hooked up to them and medical equipment in their rooms at all times. And so I wanted to be sure that I was operating safely within that space. And this really enabled me to do that successfully. There's also a function, again, on that main camera view of where you're looking out at your audience with the Omnibot. There's a capability to zoom in and out at what you're looking at. This was really helpful. For example, like if I drove my robot into a patient's room and the patient's room was full of toys and I couldn't get past just the main entrance area and had to stop the robot there, I was able to still look around the room and assess different family members in the room. All of our patient rooms also have whiteboards where our providers often will write the daily goals for the patient that day or things they're needing to work on. So during an interaction with a kid, I would be able to zoom in on that whiteboard and see what our goals were, and that would inform my practice and interventions with the kids that day, such as if it said increase ambulation. I could then know, like, okay, instead of sitting here and having a therapeutic conversation at bedside, I could encourage the kid to come out into the hallway and walk around the unit with my robot to meet that goal. Similarly, and this is the one where I don't know the correct terminology. Again, on that main screen that you're looking at for the main camera of the Omnibot, there's capability where you either click or tap on a certain part of the screen and the camera changes focus to center on where you've just clicked. So it's like a tap directionality of the camera. So this was really helpful because I was able to essentially respond in real time to events and stimuli in the environment, similarly to if I were there in person. For example, if I was talking with a patient and all of a sudden they got up and walked across the room, I was able to tap their image on my screen for my camera to follow them and to track where they were going. So that was extremely helpful. Additionally, I was able to control how loud my speaking voice was coming out of the Omnibot. So just like in real life, it's helpful to adjust your voice depending on different scenarios. So sometimes it's helpful to have a really calm, quiet voice in a room. And sometimes there's a sibling who's an infant who's crying in a room and there's monitors that are beeping and you have to raise your voice to be heard in the room. So that volume adjustment control was really helpful in those scenarios. And then there also is a share screen function on the Omnibot, and I utilize this in many different ways. And this really helped me facilitate my different interventions. So I use this, for example, in prep or education with a patient when we're looking ahead at a new experience or new procedure they're going to have to undergo. I typically bring pictures or different things for them to look at in person. But via Omnibot, I was able to just pull that up on my computer and share the screen and have them look at it on the screen on the Omnibot. So I was able to still fully do those educational preps. Similarly, during procedures, I offer distraction and support for patients. And so often in person, I'll do that by playing with a toy with a kid or letting them play a game on an iPad. But via Omnibot, I was able to pull up one of their favorite TV shows on YouTube and play a video and have them be able to watch the screen, but still hear my voice so that I could prep them for the next step of the procedures and have that emotional support and education with the distraction. So now we're going to talk about some different specific interventions that I was able to lead. So on my first day operating as the robot on the BMT unit, it was a weekend day, so we were a little shorter staffed within our team. And I had originally thought that I was going to only be able to use this Omnibot to be eyes and ears on the unit, to just be able to show my face and keep up like conversations and relationships mainly that way. I didn't know how possible or feasible it would be to support for interventions via robot. And I thought that I was going to have to rely on calling other specialists to jump in and provide in-person support. However, on this day, one of the nurses informed me that a patient was needing an NG tube. This patient was a 6-year-old male who was developmentally delayed and nonverbal and had never had this procedure done before. I called around to my teammates and they were all involved in other really high need procedures and weren't able to come support. So I could either let this patient go without support or do my best as a robot. So that's what I did. So I coordinated with our nursing team and went into the room with them. I mainly geared my prep and education towards mom, again, since the patient was nonverbal, and I was able to discuss with mom the different sensory experiences of this procedure and tips and tricks for how she could help with coping and support the patient. This procedure is not comfortable. If any of you have had a COVID swab, you have a tiny glimpse into what this might feel like. This procedure entails a tube going up your nose, down your throat to your stomach. So not ideal. And so definitely required some support and coping strategies. So I was able to work with mom to determine a coping plan. And that included a comfort position where she could snuggle with patient and help keep him safe, but also could get him in the right position that our staff needed him to be in and help redirect his hands so that he wouldn't try to disrupt the procedure as it started. I also coordinated with our nursing team. We had several nurses in the room for this procedure, and coordinated with them to advocate for one voice. This is a practice we use in child life. It means that there's one voice talking in the room during a procedure, because if 5 adults are in the room all trying to tell the kid, you're doing a great job, keep going, you're almost done, it's actually more overstimulating and overwhelming to have that going on than it is helpful. So I was able to talk with the nurses and provide that coaching, and to designate one specific nurse to be the one who was going to talk during the procedure and say the steps as they occurred. The procedure actually went so successfully and so smoothly. I was really just blown away, and I ended up rolling my robot out of that room, and I just felt like so many doors were now open to me, because I realized that all of the support I provided in that room for that intervention was everything I could have provided as a human in person. The only thing I might have additionally been able to do was hold a barf bag in case the patient needed it, which I do sometimes do that and act as a cup holder. But that was the only thing that would have truly been different than what I was able to do via robot. So this informed me that I was able to support patients through these different interventions, that yes, of course, someone in person would have been more ideal, but if no one's available or no one can come for a certain support or emotional or intervention, that the robot was definitely a capable option, and that I was going to be able to really support a lot of clinical needs through this capacity. Another example of which was a new cancer diagnosis that I helped with. So this was a female teenage patient that came in. I was able to meet her and family and introduce Child Life Services. I was able to process with her about her experiences thus far at the hospital and give her emotional support around her anxiety with this new diagnosis. I was also able to prep and educate her for her upcoming MRI that afternoon. And with use of the Omnibot, I was able to use the share screen function to pull up pictures of an MRI and play audio of what that experience would sound like, because it is a pretty jarring noise. And then later that day, I was able to follow back up with her and bring normalization items for comfort, and to follow back up on that emotional support to see how the MRI went and how she was doing later that day. I also was able to help facilitate an end-of-life sibling visit. I had worked with a patient and family for many months and developed a really strong therapeutic relationship with them. This patient had bounced back and forth from the ICU to the BMT unit, had been intubated and sedated multiple times, and just had a really tenuous medical state. During this time, the parents did not want younger sibling to come visit. But when I was operating as a robot, the patient was back on the BMT unit, was alert, was able to engage minimally. So the parents thought this would be a great opportunity to bring sister back to the hospital. She had not been up there for months. And so they were nervous and wanted support in educating her. And they knew I was a robot at that time. I was still doing check-ins, and they requested that I be the one to facilitate it versus having someone else that they didn't know be in person. So I coordinated with parents, and my robot met parents and sister coming off the elevator, coming onto our floor. I then was able to drive my robot and escort them to the BMT unit. I got to give sister a tour of the unit to really make sure she felt familiar and was able to normalize with the space. And then we went into the patient's room, where the sister was able to point at all of the different medical equipment and monitors in the room. And with the Omnibot's capabilities, I was able to tap my screen to where she was pointing in the room, or zoom in to be able to see what she was asking about and what she was referring to, so that I could really give that accurate and appropriate prep and education so she could feel comfortable in that space. I then also had her get out all of the items that were in the basket on my robot that I brought for them. It was a bunch of different activities and art projects for the sibling to engage in together during this visit. One such project was this memory art handprint work that we did. And throughout this visit, it just was a really positive and therapeutic experience that ended up being a really great memory for this family to have. And again, I was able to facilitate all of this via robot. And it again would have been very similar to if I were in person. I would have done all of the same tasks that I did in this scenario. The last specific intervention I'll go into detail about is pill swallowing teaching. So we do teach kids quite often how to go from taking liquid meds to taking pills, and we do this by having them practice with different size candies. Back before COVID, we didn't always have to wear masks when we were engaging with patients or inpatient rooms necessarily. So I would engage in pill teaching by taking the candies with them and practicing and modeling and coaching that behavior. Since COVID, we do have to wear masks at all times in front of patients and families and when doing direct patient care. So that's no longer an intervention that I do in this hands-on capacity. I now just give resources and the candies for practice to parents for them to lead that exercise with their kids. But you'd be shocked with how many adults still don't know how to swallow pills or aren't comfortable with it. So that's not always an ideal option. But when I was operating as the robot, I was sitting in my office talking to no one but my computer screen. So I didn't have to have on a mask in that capacity. So this was an intervention that I was able to bring back, and I was able to sit with kids via Omnibot and do that pill swallowing and teaching with them like I used to do. So this was actually an opportunity that I was able to provide an intervention via robot that I couldn't do in person or as me as a human with them. These are just some of the other common interventions that I engaged in on the unit during my time with the robot. So, of course, emotional support and daily check-ins on patients. I attended medical rounds at patients' bedside with the team. I supported for different procedures, such as sterile procedures for central lines, like dressing changes, port accesses. I conducted different consults, like BMT workup meetings or sibling donor support educations. I helped facilitate and engage in different celebrations, like birthdays or bell ringing ceremonies. And one of my favorite things that I did was help with ambulation. I did this through different fun and games. So I got to bring kids out of their rooms into the unit hallway on BMT and use the robot to play hide and seek or tag with the kids. Of course, the kid had to be moving a little slower in order for tag to be an appropriate game. I also used the nurses and providers to help me set up obstacle courses or scavenger hunts to engage in with the kids. And I even invited multiple patients into the hallway to do group activities like Simon Says or freeze dance, where I was able to play music through the Omnibot and pause it and see who wasn't frozen. Of course, throughout this process, there were different challenges that arose. Like I mentioned earlier, my robot did not have hands or arms, so opening doors was a consistent issue. I'm sure the staff got pretty annoyed with me with always calling ahead to make sure someone could open doors for me. I did at one point try to go forward and reverse into a door to see if I could simulate knocking. It sounded more like I was trying to bust down the door, so that was not a viable option. Also, let's see. Oh, also there's the Omnibot didn't have capabilities for badge access. So even some of the doors that were automatic that I would typically just scan into, I couldn't do that with the Omnibot either. So I again had to rely on someone else to let me in. There were some internet connection issues where either the audio or video feed would go in and out before it came back. There also was no rear view. So this was only an issue a couple different times with specific circumstances, such as if I was attending medical rounds with the team outside a patient's room in the hallway on the unit. We would all be facing the patient's room, listening to a fellow present on the patient's case. And so I wouldn't realize when either a wheelchair came behind me or a bed on wheels came behind the robot and was needing to get through and needed us to move out of the way. So those were very specific and isolated incidents. Also, there were some audio feedback issues at times. I was super fortunate that this time when I was using the robot is also when our hospital decided to test our fire alarm systems. So that did cause some issues with feedback where I just had to go completely mute or turn off the robot for that period of time. Also, as I mentioned before, all items going onto the BMT unit have to be completely bleach wiped. So that meant that after every patient interaction, the Omnibot had to be completely wiped down. So I either had to ask a nurse or a provider to do that before I went to the next patient interaction, or I had to drive the Omnibot all the way off the BMT unit to my office for me to wipe it down and then send it all the way back. And lastly, the challenge that I never anticipated, but I probably should have knowing my unit, was that the robot was subject to the whims and the mercy of those around it. So more often than not, it was the nurses and the providers rather than my patients that like to play jokes and pranks on the robot and on me. So they did this number of different ways, but some examples were that a provider would pick up the robot and see how long it took me to realize that I wasn't moving anywhere. Another example would be a provider blocked the camera screen so I couldn't see anything, and they picked me up and moved me to a different location and then uncovered the screen and wanted to see if I could find my way out of where they put me. So you can never really anticipate what crazy people are going to do around you, but it was all in good fun. Some ideas for troubleshooting some of those challenges. The first one was a suggestion from Abe, our gaming technology specialist, that to combat some of the connectivity issues, maybe it would be a possibility to use a Wi-Fi hotspot for the Omnibot. And then if the Omnibots were being used more widely in a clinical setting, such as how I was using it by more providers, there could potentially be capability for having providers link their badge somehow to the Omnibot in a safe and secure way so that the Omnibots could drive up to those different scanning stations to badge into different areas of the hospital. That would be really helpful. Also, in order to help with those examples of when it would be beneficial for a rear view, there could be a way of having a rear view camera that you could just turn on if you were stationary and needed to see a full surround view so that you could be aware of your surroundings. And lastly, again, if this were being used more widely in healthcare by clinicians, it could be beneficial to have a UV light station that the Omnibot could drive up to and just spin in a circle to get cleaned before going on to the next patient room instead of having to be wiped down with bleach wipes every time. So COVID-19 is when our world kind of took a turn for going towards Zoom calls and work from home and telehealth within healthcare. Our hospital, and I know most others, are still really relying on telehealth and technology for providing healthcare services. I think that this use of an Omnibot to provide clinical services could be the next step above and beyond Zoom or what we're currently using. I think there are a lot of future implications for this use of technology. These are just a few things that I have thought up and that have occurred to me throughout my use with this robot. Different departments or clinicians that were not able to work from home now may have that capability in using the Omnibot to provide services. This would be such as our child life team. During the pandemic, it was determined that our child life team was not able to work from home because of our different support and interventions during procedures and hands-on support, that it really would not be equivalent to log on to Zoom calls and support patients from home. And I agree. That's why I didn't use Zoom or those same modalities during this 6-week period when I wasn't able to be patient-facing. But I do truly think that my use with the Omnibot was a valuable and capable use and way to provide child life services. Again, it would always be ideal to have someone in person to provide those services, but if a patient is needing support and you're low staffed, I think this could absolutely be an option that is the next best thing. Additionally, we have many providers here at our hospital that set up Zoom meetings, just one after the other, to meet with patients throughout their day and work remote. I know in our CCBD clinic, we have patients who come in for blood draws, but then don't have anything else to do in clinic and then just have to wait for their Zoom call with their provider later in the day. So their day is kind of segmented and spread out. Because of this, this is because our providers have to schedule 30 to 45-minute Zoom meetings, which each of the patients they're supposed to see virtually that day. This is because they don't know if it's going to be a short meeting or a long meeting, so they just have to prepare in case it goes that full time. But that really also breaks up their day and isn't the most efficient use of their time. If one meeting only lasts 10 minutes, they then have to wait 30 minutes until their next one. So this could be an option that our providers just log on to an Omnibot and just go room to room as these patients are getting blood draws, and they're able to more efficiently use their time and the patient's time and have the rest of their workday to dedicate to other needs and tasks. And lastly, if hospitals were to use Omnibots more and were to be open to using them in this clinical capacity, it could open up the opportunity for departments or hospitals to hire clinicians to operate as traveling providers, but work from home. So what I mean in this is a hospital may hire traveling nurses to move to their city to cover staffing holes for a period of time. But let's say that a child life department has multiple staffing holes. They could reach out to a work from home child life specialist anywhere in the country and contract them to log on to the child life department's Omnibots and help cover patient needs via robot to support those needs that are currently being missed just by not having enough people there. So again, not a true replacement for an in-person staff member, but could absolutely bolster and help support a team. So those were just some of my ideas. I'd love to hear if any of you have ideas or if any of you have questions, and just thank you again for letting me talk with you today.
Woo, Carline. See, you did great, and next year you're going to MC this thing. Okay?
We'll see.
So, we'll just switch. No, there were some questions that did come up in the chat that a lot of it has to do with other organizations also use these, which is really cool. A lot of them are saying they have them manned at the same time, but questions about upkeep versus use versus impact, like how would you position that if you're, especially if you were an organization or a program that did not yet have one, how would you, the term elevator pitch came up earlier. What would your elevator pitch be to leadership for those people to help show the impact versus cost and impact and things like that? And Abe's right next to you too, if you want to.
Yeah, that's fair. So he may also need to jump in. I think that an elevator pitch for using it in the way that I did as a clinician would be tough, since this is not really something that we're doing on a large scale or consistently. But as far as using the Omnibots for patient use, it's something that I have seen with BMT patients where it has really changed their whole outlook or changed their demeanor within transplant and given them that element of freedom and exploration and ability to not feel like they're missing out on what's going on in the rest of the hospital, and that they're still able to engage with peers outside of the unit and to go outside via Omnibot and see if it's snowing or if it's raining that day. And that really is just invaluable to me, of these opportunities to bring glimpses of positivity and memorable experiences that bring joy to these patients during a really hard hospitalization or treatment. So I feel that alone is worth it to me. But if Abe wants to jump in from a tech standpoint, he is more than welcome to.
Hi, everyone. I didn't add anything. I think Carline covered it really, really well. I would just reiterate.
Carol, can you just keep your mic for a quick second while you stop?
Want me to do that?
We're right next to each other again.
See, it's not just me.
There we go. No, I think Carline did a really great job of covering it. The things I would reiterate to any leadership is being able to offer interventions that might be off the table, like with the pill swallowing, or enabling kids who might not be able to leave their rooms or have been at the hospital for months or years, give them the opportunity to engage with their community around them, whether that's like going to a baseball stadium or going to a graduation or going to prom. It just really normalizes a kid's life, even if they're in the hospital. And I think that's super, super exciting.